Okay, so we are live. Thank you everybody for being here. Welcome to our town hall meeting. I'm State Senator Brian Kavanagh, and we're here tonight to discuss the path to reopening New York City, a topic, of course, that is on everyone's mind as we enter the another month of this very difficult situation that we've been in. Thank you all for joining us. Before we begin the substance, just a note on translation. We have translation that is available in Spanish, Mandarin, and Cantonese for those who would like it through Zoom. And please use the interpretation button on the right-hand side of the Zoom screen to select your language. And I'm going to provide that information now in each of those languages. So Lana?
OK， 係各位晚安，好歡迎參加今晚黑由州參議員Kavanagh舉辦嘅為重啟呢個經濟華埠嘅視像會議。咁我哋今晚黑咧係有3種翻譯嘅，分別係廣東話、普通話以及西班牙話。咁喺你右邊嘅上角咧，你可以選擇。You want me to say it in Mandarin? Mandarin too?
Yeah, I think so.
Oh, OK. 大家好，欢迎你们来到今天晚上参议员 Kavanagh 举办的这个重开华埠经济的会议。我们现在今天晚上呢有3种语言，分别是广东话、普通话和西班牙语。请你在右边的选择你需要为你们翻译的不同的语言。谢谢。
Great. And Eliana?
Para escuchar en español, haga clic en el icono debajo que dice Interpretación en Zoom y seleccione Español. Gracias.
Great. Okay. Thank you both, and thank you everybody for viewing from home, and also thank you to our translators. So we will be recording this town hall, and it will be available, posted at a later time on both our website at nysenate.gov and on Facebook. We've received many questions so far, which we've combined and summarized to try to get through as many of them we can. People who are viewing this live can also feel free to add additional questions in the Zoom chat box or on Facebook. We're going to prioritize questions we received beforehand, but we'll try to work in your live questions into the conversation as well. So just one more preliminary. We are here to talk about reopening New York tonight, but of course our office is available for a full range of services if you're having difficulty accessing unemployment or getting food or personal protective equipment for your organization or anything else that we can be helpful with. Please do reach out to our office. Our number is 212-298-5565, or you can email me at Kavanagh, Kavanagh, @nysenate.gov. So with preliminaries out of the way, let me just introduce briefly our topic and our panel tonight. As I've said, we're discussing reopening New York after 2 months of restrictions that, of course, we're all familiar with, included closing all businesses deemed non-essential, postponing social gatherings, including sporting events, concerts, Broadway shows, and other theater, and even important family and community rituals and holiday gatherings. We've been all trying to practice social distancing, at least 6 feet, limiting outdoor recreation activities, and limiting the use of public transportation. We know that these restrictions have enabled New York to reduce the spread of COVID-19 and likely save thousands of lives. However, of course, they've also taken an emotional as well as an economic toll on all of us. Millions of New Yorkers have filed for unemployment benefits. Thousands of residents are struggling to pay rent and mortgages, and hundreds of businesses are suffering from financial hardship and wondering whether they'll ever recover. And that really is just the beginning. With New York now hitting 5 of the 7 metrics for reopening set by the governor, and I think we'll talk a little bit more about what those metrics are, the time is ripe to discuss reopening New York City. We have to do this in a way that helps revitalize our economy without sacrificing public health. How do we do this? So for answers to that question and others, I'm joined by a very distinguished panel of experts. And I'm going to ask each of you to just very briefly introduce yourself and talk about briefly what you do with your respective organizations and your connection to this question of reopening New York. So first we have Dr. Jane Bedell, who is an Assistant Commissioner and Medical Director of the New York City Department of Health and Mental Hygiene. Jane?
Good evening, everybody. I assume people can hear, otherwise we have the international symbol.
You're good.
So I'll just say briefly, I've spent the last 17 years at the New York City Department of Health, been involved in many different challenges over the course of that time in New York City, including Ebola, the response to Superstorm Sandy, Legionnaire's outbreak, recently the measles outbreak. And I actually had retired about 2 months ago, and as soon as I retired, got called back in to volunteer. So now I'm here to represent the Department of Health and really to answer the questions, because there's a lot of information out in the world. Some of it is good and some of it is not so good, but what's important is that people get the answers to their particular questions, because sometimes it's hard to wade through everything. So I'll reserve any other comments until we get moving with questions and discussion. Thanks.
Terrific. Next up, we have Jackie Bray, the Deputy Executive Director of the NYC Test and Trace Corps.
Thanks so much, Senator. Like the Senator said, my name is Jackie Bray. I'm the Deputy Director of the New York City COVID-19 Test and Trace Corps. We are the team, the really interagency, intercity team that's been set up to test every New Yorker, to find all the cases, talk to all the cases, identify their contacts, talk to all of those people about getting tested and about safely separating anyone with COVID and anyone who's been a close contact of someone with COVID-19, safely separating from their household members, safely separating from their family and their neighbors and their colleagues, so that we can really stop the spread of this virus. And I'm excited to be here tonight to take your calls, or to take your questions. I spent the last several years in city government, and before that in the federal government here in New York City. I was the director of the Mayor's Office to Protect Tenants and the first deputy commissioner at the Department of Homeless Services. And so I've really had a focus on public sector management, but really the service of the most vulnerable New Yorkers.
Great, thank you. Next up, Wellington Chen, is the Executive Director of the Chinatown Partnership.
Thank you, Senator. Glad to be here. As you know, just like Dr. just mentioned, Chinatown Partnership was created after the SARS of 2002 and 2003, especially 2001, due to Bin Laden's work. We were created in 2006, and we work with our companion organizations, such as the Chinatown Bid and many other nonprofits, trying to deal with this one blow after another. 18 years coming up on 19. And we just want to make sure Bin Laden does not laugh in his grave.
Great, thank you so much. And last up on our panel here is Marcus Book, Assistant Director of Government and Community Relations at the MTA New York City Transit.
Yes, good evening, everyone. Thank you, Senator, for having us and having me. I, again, work with New York City Transit. I work for Government Community Relations at New York City Transit. I've been with the agency for about 35 years. I've basically, my entire working career has been spent at Transit. So as you all know, we've been hit pretty hard with this tragedy. It's been tragic for a number of our employees. We've lost to date, I think, 123 employees, and quite a few thousand are still in quarantine. But we are seeing a turnaround in that and having employees coming back to work. So as we begin this discussion, you know, we prepare, and we're preparing, we'll talk about it more tonight. We're preparing to receive New York when it's ready to come back. So thank you for having me, and I look forward to talking to you tonight.
Thank you so much. So welcome to all of you, and thank you for being with us. And just as a preliminary matter, someone named Eddie Morris has said in the chat room, are you downplaying the crisis? It's been 3 months. I think it had more than 2 months, but yes, the official pause order, the first emergency was declared on March 7th. So we are really approaching 3 months of this. So, and obviously certainly not downplaying it. We've been living this every day, and it's had enormous consequences for all of us. But thank you for that clarification from Mr. Morris. Okay, so we're going to begin just with a general question. The governor has set forth 7 metrics for reopening. Can you tell us, this is probably best for the health department, but anybody wants to chime in, can you tell us what the metrics are and how New York City is progressing toward those metrics? Anybody?
Dr. Bedell, I'm happy to take that, or happy to have you take that. Let me know.
No, I think that would be great if you could take it.
Yeah, of course. So there are 7 metrics set forward by the governor for every region across the state. And those metrics are the same across the state. The city has met 5 of the 7. The 2 that we continue to not yet meet, the first is availability of hospital beds. So we are required to have 30% of our hospital beds available and 30% of our ICU beds available. We just met the ICU bed metric for the first time today, or we'll meet it tomorrow if it wasn't in the press conference today. We're still a couple percentages short on the total hospital bed metric. And then the second metric that we haven't met yet is the number of contact tracers hired. So we have 1,700 people, or over 1,700 people at this point, starting on June 1st, starting on Monday. We need to get that number up over 2,500 before we have met that metric, and we expect to do that in early June.
Great, thank you. And can you just tell us a little bit more about the role of antibody testing and contact tracing?
Sure.
Okay.
Yeah, go for it.
So just to be clear about the testing, there are 2 types of testing. One is the test for the virus. That's sometimes called a PCR test. That test is going to tell you whether you have the virus right now, today, whether you have the virus. And that's, of course, extremely important, because if you have symptoms and you have the virus, you're first of all, we have to be very careful and monitor you, although most people do fine with COVID infection and do not need to come into the hospital. There's a small group of people who do, and then a smaller group, but quite significant clinically, who run into a lot of trouble, including, as we all know, deaths. And just to remind ourselves that here in New York City, we've suffered over 20,000 deaths so far. So the test that most people are thinking about as the test for the virus is called a PCR test. And again, it tells you whether you have the virus right now, today. The antibody test, which is the phrase you just used, is a very different test. And that measures whether or not your immune system has seen this virus sometime in the past. So I could have been infected with COVID in the very beginning, let's say in February or March. I did fine, never had to be in the hospital. If I got a "am I infected right now today" PCR test, it would be negative. If I got an antibody test, which measures whether or not my immune system has ever seen this virus, the antibody test would be positive. So New Yorkers are going to have to learn these 2 kinds of tests. I'll just remind people what Deborah Birx said in one of the briefings at the White House. The people who have worked in HIV care are very aware of how these tests work and what they mean and what they don't mean. Most important test for New Yorkers now is that first test, the PCR test, because that says whether you're infected now. The antibody test, we don't quite know what to do with the results of that. So the focus is going to be on the PCR test, but there will be more and more use of the antibody test. And I don't know, Jackie Bray, if you want to add into that.
You know what, that's exactly right. So when we say test and trace, we're talking about that PCR test. We need to know who's infected today and who are their close contacts. And just want to repeat what the doctor said. We do not know yet the type of protection, the length of protection, the durability of protection that antibodies give on this disease. And so it's really important, as New Yorkers get more antibody tests, it's really important that people remember that that is not permission to not wear the mask, to not practice social distancing, to not continue with really good hygiene and to continue to be safe.
Okay,
Now,
so
I'll just add
about-
one other thing, which is,
Go ahead, please.
so sorry to interrupt, but people who want to test, who are interested in getting tested, it's very simple to just call 311. There are more testing sites opening up. There's a whole list of them. You can get the whole list, or you can just call 311 and discuss it with the person there, who also will guide you through these two different types of tests. But most people are interested in, am I infected with the virus now, and could I be infecting other people? Of course, nobody wants to do that, but you need to know your own status first. So in order to get a test, 311.
And we were early on in this crisis, we had very restrictive rules about who could get tested and who couldn't. Is that opened up now? If I am somebody who has some symptoms, do I need a doctor, or can I just call 311 and go get a test?
It's
You
very,
can just
it's
go
very
get a
available.
test. Yeah.
It's very
Yeah,
available.
testing's very, yeah, that's right. And even more than available, we need you to go get a test. We want New Yorkers, if you have any symptoms of COVID, so flu-like symptoms, if you have been in close contact with someone that you know has COVID, if you work in a residential congregate setting, so if you work at a nursing home, you work at a shelter, you work at a criminal justice institution, and if you are a frontline essential employee who is working, interfacing with the public often, not only can you get a test, we need you to go get a test. And so the doctor's right, there are well over 100 locations now across the city. You can call 311. You can also go to nyc.gov/COVID test, and you can find the closest testing site near you. All of the city sites, all of CityMD, we just announced a new partnership with Advantage Physicians. Those are all free to anyone, no matter what your documentation status is, no matter whether or not you have insurance, and they're all walk-ins. So go get a test if you need a test.
Terrific. Okay. And Virginia from Manhattan asks, how do you become a contact tracer?
Yeah, great. We will post, I'll send you, so you can post on your website the link to apply, but we are still hiring thousands of people, and we'd love people to apply. And so if I can find the link while we're still on here, I'll read the link out loud, but would love that.
All right, and maybe we can post it to the chat as well, so my staff could do
Yes,
that. Or
okay.
that'd be terrific. Okay, good. And Dr. Bedell, do you expect a second wave in New York City, and what would that look like?
So the mayor likes to talk about some things that are the X factor that we don't know. This is a big X factor. We do know historically that other viruses have also had this second wave phenomenon. So if you're a betting person, you're probably going to bet the answer is yes. But the real truth is we don't know yet. And therefore, as a city, as a municipality, as a state, we need to be prepared for it. And just to remember, it's not only to protect the people who are particularly vulnerable, the elderly, and people with certain medical conditions. It's also to make sure that we do not ever come as close as we did to overwhelming the medical care system. So we've got a lot of reasons that we want to be super prepared, and in everything that we do, not only respond to what's happening today, but make ourselves more resilient for tomorrow. So the short answer is we don't know.
Got it. Okay. So I'm going to I recognize that I'm watching the chat. We do have a lot more questions on testing and stuff, but I'm going to move on. We may try to filter some of them back in as we go forward. But so we have a question. As New York City, I guess, I'm going to combine two here. It's what impact has the temporary shutdown had on local businesses? And as New York City hits the 7 metrics, which businesses will reopen first? And how long will the reopening process take? I don't know if Wellington, do you want to jump on any of that, or?
Yeah, great.
I will let Jackie answer that one. She's more up to date on that one.
Okay, Jackie.
So I'm not an expert on the impact to local businesses, but obviously we've seen significant unemployment, and we know that our small business owners are really struggling. We're focused through the small business services team on how we can support small business owners, but I'm not the right expert for that. What I can tell you is that in phase one, the businesses that will reopen, construction, manufacturing, and some retail for curbside pickup will reopen. So that's what you'll see come back online first when we hit phase one.
And to follow up on Jackie's thing, in terms of economic impact, one of the reliable indicator for us in the Chinatown business improvement area is that we've been blessed with about 118 solar panel trash collectors, and they're giving me daily readout of the amount of foot traffic and amount of trash that's being picked up. And I can tell you that we hit the bottom sometime in late April, but the foot traffic has started to pick up starting in May. So we are noticing an uptick lately as a good sign. And the other indicator is that I had to thank my team, my volunteers and my staff. They've been calling all the stores every day. And during the shutdown, there were about 117 eateries that remain open out of the 291 that chose to stay open. And at the low, it dropped down to 39. And as of this afternoon, it went back up to 126, exceeded the 117 when we started at the beginning of the pause around March 16 or March 23.
Yeah, it's in a very, very tough situation in a lot of our neighborhoods, and certainly, especially in Chinatown. Tanya from Brooklyn says, with the reopening of the state and city looming, as a restaurant owner, I'm having a difficult time understanding the guidelines that are required in order to reopen. I fear that we will get the all clear to open, but I will have no idea what I need to do. What advice would you give to Tanya to try to figure out what's going on and what she needs to do to get her business reopened safely?
So we actually just put out tonight a list of protocols that every business who reopens in phase one will need to follow. And so I'm going to email that, Senator, to your staff, if that's okay. But literally, maybe an hour ago, we put out a very clear list of the type of symptoms checks, the type of hygiene protocol, the type of distancing protocol, the type of cleaning protocol that any business that is going to reopen will need to follow. So we'll send that around.
And just to reiterate on, the major points, none of this will be a shock or a surprise to any New Yorker, because we have been, actually fairly successfully, if people are tracking the numbers of newly infected and the numbers of people, unfortunately, an important number to track, the people who are dying on a daily basis from COVID are dropping significantly. So the basic premise of all of the guidance for businesses opening are what New Yorkers are already completely familiar with. Most important thing is the distancing. And if you can't achieve that, face coverings, and then to protect yourself, hand hygiene, the magic of soap and water for 20 seconds. So there will be other things added on, but to remember over and over again that the basic principles are unchanged really since the early part of the pandemic. And that's what needs to be operationalized into the specifics of each person's business, the physical layout, et cetera, et cetera. But it won't be a surprise to anybody. It'll just be more detailed.
It's interesting, as in the early phase of this, when people were still going out a lot, there was a lot of emphasis on wash your hands. I actually just leaned on my hand, which I think for a while I had gotten in the habit of not doing, but I think some of us really do need to relearn those habits as we're going back out in the world. So I think messaging on that is going to be very important. Jennifer,
right, and then making it specific enough that it makes sense in whichever context you're in.
In the context of
right?
each
that's key.
Yeah, exactly. Yeah. Jennifer Manhattan asks, can the city or the state help procure plexiglass barriers for community-based organizations and small businesses to implement safety precautions in the workplace? Can you talk a little bit about whether it's plexiglass barriers or other kind of physical aspects of safety? Is there any resource that people can, for those kind of materials, can access? Anybody aware?
I'll have to get back to you. I'm not sure if we're giving out those resources. I think they're certainly being used around the city, but I can make sure that your staff has that information from our team.
Great, and I'm not familiar either, but we will, like I said, we'll follow up, and we will post all of this material on our nysenate.gov website afterwards, as well as presumably on the along with the Facebook conversation. I'm going to go back, just we have a lot of questions about testing, and I'm going to, Dr. Bell, thank you really clarifying before the difference between the antibody testing and the kind of infection testing, but a lot of questions about the antibody testing, the reliability of it, whether antibody tests, positive antibody tests are being added to the count of people who were infected. Somebody asks, this is a nurse who lives in a large apartment complex with 1,700 units. Might be the public health reason to sort of test every person in a place like that rather than people who might be volunteering to get a more statistically valid sample of those who, rather than just sort of having volunteers who might be, it might be a biased sample because it's people who are out volunteering.
Okay, so let me say a little bit about how the antibody test can be used. It can be used not so much on the one-by-one individual level, because even if I am antibody positive, let's say again, using that example, I had COVID early in the pandemic, I recovered, and now I'm curious, so I want to get a test. I get the test. It's positive because I had COVID. What's the action that I need to take because I had a positive test? It is no different than the action I should be taking every day, which is to protect myself and to protect my community from COVID. It's the social distancing, it's the face covering, it's the hand washing. So whether or not you're antibody positive or not, you need to do exactly the same thing. So on the individual level, it is not particularly a game changer. On the population level, it's quite helpful to us in public health because we're going to get a sense of how far this infection reached into different zip codes, different professions. So the CDC, for example, is doing a study right now using antibody testing of healthcare workers and asking a set of questions. They're going to use that, and that's going to help us understand how much risk there was in the healthcare worker population. So it's more used to understand what's going on in the community. It is less useful. The antibody test is less useful on a one-on-one individual level because it does not change what you still need to do. If your PCR, if your infection test, as you called it, that's a good term, I think. Am I infected today? Oh yeah, that's a game changer. If I'm infected today, then I've got to isolate myself so that I don't infect anybody else. If I can do that safely at home, yay. And if I cannot, the city is going to help me isolate myself safely. So that's a game changer. The antibody test is not so much of a game changer. And as I think the question insinuated, how reliable is that test? For better or for worse, many of those different ways of testing for the antibody came out onto the market at a similar time, and some had better testing characteristics than others. I think that's going to be sorted out over time, and we will certainly health and hospitals and reputable hospital medical centers are only using high quality tests. So it's an important question to ask, but I think that the reliability of that test will get better over time, because I think that was part of the question if I was hearing it correctly.
Yeah, I think that's correct.
Yeah.
Okay, so just a quick procedure announcement here. We're going to take one more question, and then we're going to take a very, very brief break to sub out, give our translators a break, and so we're going to sub in new translators on the same languages, so that will continue. But just before we do that, Shelley from Manhattan asks, when will it be safe to use public transportation? And has the MTA given any thought to increasing bus frequency, limiting passengers, or other steps to make it safer? So maybe we start with Marcus from MTA, but if anybody else has comments about public transportation generally, we welcome that from any of you.
Okay, thank you for the question. I think that, over the last couple of weeks, our chairman and transit president, Sarah, has been pretty clear that this is going to be a really heavy lift, and it's going to be really tough to social distance within a subway or a bus. there's just not a lot of room inside there for everybody. And we're all from New York, and we know that these conveyances can get pretty crowded pretty quickly. So I think we're going to require face masks for anyone that's using the subway system or the bus system. We're going to ask that people wear face masks, and this is for the health and safety of the customers and our employees. We're going to ask that people try to, maintain as much distance as possible. And right now, as we, although there's been discussion about the city opening up in phases, the city is not quite yet open for business. So right now we're talking and working with our partners in different transit agencies. Our consultants are working on a report which is forthcoming that will talk about and discuss best practices of other transit agencies around the globe. And we will incorporate all that stuff into the best possible plan that we can to keep our passengers safe. It's not going to be easy. I think,
所以这个步骤是很不容易的，所以我们是希望
I think that might have just been a microphone going on inadvertently into this feed.
Okay.
But I'm not sure. So if you, Marcus, are you finished? You want to just wrap up and?
Yeah, I think that really says it's going to be tough. We are going to apply all the best practices from around the globe to try to make sure that it's the safest possible for our customers and employees.
Okay, so we're gonna go very briefly now into town hall on pause, which is not New York on pause, but just this moment so that we can get our translators to switch out. So if everybody could just bear with us for a moment. And my staff, I think you'll tell me when we're ready to resume. Getting the almost ready signal. I apologize for this delay, but we do want everybody to participate on equal footing here. So, okay, so that we now have a new set of translators. Welcome, new translators, and thank you for your service tonight to make sure that all of our constituents can access this. Marcus, there's another question for you. We have MTA suspended the overnight service in order to sanitize the trains. How's that going? What has been its effect?
So it's actually going really well. It allows us to clean and sanitize our entire rolling stock and buses on the overnight. We're beginning, it was an announcement earlier this week about a UV light pilot, which we're going to be implementing. And this UV light has been shown to kill the COVID-19 virus and prevent it from adhering to the surfaces on buses and subways. So we're partnering with a Denver-based startup, Puro Lighting, and we're going to be putting these about 150 in the first phase, 150 of these mobile disinfecting units inside our subway system on the overnights to make sure that it's effective in doing what it says it's going to do. It's already been tested in the lab and it is effective. But the efficacy of doing it within the context of a huge system is quite different. So we're going to be working on that. We're also disinfecting, testing microbials, antimicrobials, and it's been going really well. We've got very few complaints from people on the overnights. We've instituted an essential connector that deals with helping people get to and from their jobs for those who are essential working on the overnights via bus, and cases where their trip would be over an hour and 20 minutes, providing some kind of car service for them. So to answer your question, it's going very well.
Okay, good. We have a question. This is from Lisa Bosted, if I'm saying the name correctly, from Bull Hill. What is the maximum number of, and this might be for Marcus or maybe Dr. Riddell, but what is the maximum number of masked people who can safely get into a subway car, and let's add, or a bus? I think that's probably not a precise figure, but can you give us a sense? If we're assessing, we know that when our economy is fully functioning, sometimes our subway cars are jammed together. Is there an expectation that for public health reasons, we're going to have to space those out or limit the number of people who get onto the cars?
So one thing I can say is that we're going to learn a lot through contact tracing. We're going to learn a lot about how people become positive. In the contact tracing that has been done in other countries, particularly Wuhan, there is some transmission in transportation, but they have different systems than we do. So each municipality is going to have to learn its own uniquenesses. The overwhelming majority of transmissions happen among household contacts and close contacts in specific kinds of workplaces. So there are just some general principles that are make being in a subway car or a bus very different than being in a home or being in a work site. One is that the doors are constantly opening and closing and people are moving around. So the air itself is moving around, which is a good thing. And the other thing is that we spend hours and hours and hours in our homes. And that means that the people who live in our homes have hours and hours and hours to be exposed to us if we're carrying the virus. That is not, I know it is true for some New Yorkers that they do spend hours and hours on the subway or on the bus system, but the vast majority of people do not. It's a short-lived time. So we're not gonna, I don't think we're ever gonna be able to answer your question so specifically, but we are gonna learn a lot from contact tracing. And then we will be able, and this has been done in other municipalities, then we can sort of tighten or loosen the guidance or tighten or loosen what's happening in terms of disinfection or trying to get better air exchange, et cetera, et cetera. So some of this is going to be a learning process. Some of it is us watching what's happening in other places where they are already easing up on some of the restrictions, but unlikely to be as sort of scientifically, precise as I think we all wish it could be. It just doesn't work that way. I don't know whether you want to add anything, Jackie Bray, on that. Okay.
Okay, good.
Yeah, that's absolutely right. That's right.
Okay. So Marcus, from the MTA perspective, will the MTA be taking any step to limit the number of people who get on a car, or will it be sort of like up to the public to decide how many? And I guess there was a question about whether you'll be limiting the number of people going to stations or platforms. It's just, is there going to be you expect some control of the flow of people or traffic or crowding?
First, I'll answer that question. First, I do know the name of my president, Sarah Feinberg. I work with 4 Sarahs, and sometimes those Sarahs get mixed up in my head, and I don't know which one to shoot out. But what I can tell you right now is that what the chairman has said continuously is right now, everything is on the table, and how that's actually going to be instituted will be determined on a lot of factors, the number of people that return, how fast they return to the system, what resources we have available and the health of our employees. So there's no firm answer. It's sort of like the question Dr. Bedell was asked. There's no real exact answer yet on that because there's no data to really work with. But we will be instituting the best practices to do it as safely as possible.
Okay, so you do expect, you're not sure what those protocols will be, but you have a sense there will be some effort to limit the flow of people and crowding and all of that.
I think that's a challenge. I mean, metering, all this stuff is being discussed. I mean, if it's feasible, then and it's safe and it can be done, then I think to save lives and to keep everybody safe, we would consider it. But how that's going to work, I really couldn't tell you tonight.
So I'm just going to brief interlude here. We're getting a lot of questions in the chat about small businesses and paying rent and housing, rent payers and evictions and all. I just want to note we had a 2-hour town hall a couple of weeks ago on both small businesses and housing. And as the housing chair, I'm very pleased that less people are still interested in those issues. But I'm going to stick to the questions tonight about reopening. But again, that town hall, which had a lot of that information, is available still on our website. So, and I believe on Facebook as well. Couple of quick questions about different kinds of activities. When will tourists and people from other states be able to enter New York City safely?
Say the question again.
When will tourists and people from other states be able to enter New York City safely? I added the safely.
Safely for them or safely for us?
I would say I added the safely, actually. The question, this was from, so.
I mean, so there are some recommendations. People who come from other countries on the CDC website and anybody who's doing any international travel or receiving people in their home or their community, the guidance is quite clear that those people should quarantine, which means they should be separate from other people for 14 days. And they should monitor themselves and their symptoms. The time that the virus can come forth in somebody is 14 days. So that's why that's not an arbitrary number. That's what we know about the virus itself. So people coming from another country should be separated. For example, we have a family member who's coming back from Peru, and we're going to ask that person, as per the CDC, to keep herself separate from all of us who are in this household for 14 days, monitor the symptoms, et cetera, et cetera. Coming from other parts of the United States, it really has to do with how much community-wide transmission there is in that area. The safest thing is that whenever we move from one municipality to the other, again, is to be very cautious for those first 14 days. There isn't a public health recommendation to that effect, but you can imagine that that would be the safest possible way to handle that. Tourism is going to be a big question mark, because then, we don't want to get to a point where we have low-level transmission here and then inject ourselves with a lot of people who are going to, be at risk for us. That's a risk for us. And of course, nobody wants to be sick with COVID. So there's a lot of unanswered questions there, but a 14-day quarantine is a tried and true mechanism if you're in doubt.
So with the city, I mean, somebody, Tammy Meltzer, Tammy of Manhattan says, I read that Megabus and Greyhound are resuming transportation to New York City on June 1st. Passengers are going to be from Pennsylvania, New Jersey, and other states. Will there be any, let me rephrase a little bit. Will there be tracing? Will there be screening of people? Will there be information provided to people when they arrive about what their obligations are, what the city's position is with respect to people entering New York?
You're talking about domestic travel, right?
This is the question here is about Megabus and Greyhound.
Yeah, I don't know the answer to your question, and I'm not, and I don't know if it's being worked on. So I'm jotting that down as something I've got to get back to your office on. That you can imagine that would be a very complex rubric for people to follow, and we want to try to keep it simple without making it ridiculously not pertinent. So I will get back to you about domestic travel.
Okay, yeah, and we get several questions, including obviously there are Chinatown, the so-called Chinatown buses like Lucky Star and others. We're also getting questions about that as well. So yeah, we will get better answers to that, and we'll post it for you. Let me see. I'm just trying to filter through here. Go ahead.
I just take one that I saw because it just clarify a point.
Please, yes.
If that's okay. So somebody asked in the chat, how can it be that you could be antibody positive? That is, my immune system saw the virus and worked against the virus. How could it be that then I still have to be careful about reinfection? And that's a great question, because in general, once a person has had a virus, they are, relatively speaking, immune from that same virus for some amount of time. It depends on the virus. And we have come to know this in great detail about viruses that we've had a lot of experience with. But one of the many things that is difficult in this situation is we don't know whether or not the antibodies that you produce are what's called neutralizing antibodies. Do they really zap that virus, and do you keep them for a long time? And what's a long time? 2 months, 5 months, 6 months, 2 years, 5 years? We just don't know the answer to that. So to be absolutely cautious right now with the information that we have right now, we strongly urge people not to consider that antibody test as anything that would change your general behavior, which is to try as hard as you can not to infect anybody else and not to get infected, so that you're not part of the chain of transmission. So it is different than other advice that we give about antibodies. But again, this is a novel, i.e. new to us, totally new to human beings. And we certainly cannot extrapolate definitively from other viruses, even similar ones. We can't do that. This, for example, has a whole time period when many people are shedding the virus. They can transmit the virus and they don't even feel that sick. That's kind of unusual, but it happens to be one of the features of this virus. So we've had to learn that. And similarly, we'll learn more about the antibody significance, so stay tuned. But right now, be cautious. Do not take that face covering off if you're antibody positive. So I hope that answers that person's question. It's really because we have not had so much experience with this virus, and we will learn more, but right now we have to be super cautious.
Great. So we're going to talk a little bit about public spaces and street closures, which obviously initially have been about giving New Yorkers opportunities to be outdoors and not be into crowded parks and stuff. But obviously, there's also been a lot of talk about closing streets as a way of providing space for restaurants and other businesses to do more of their business outdoors. Jan Lee actually directs us directly to Wellington, and asking what streets in Chinatown will be closed, what's the timing for those streets to be closed, and sort of who asked for specific streets to be closed, and how are those decisions being made? I don't know if you have if you have a sense of that, Wellington, you want to share?
Yeah, Senator, that's actually a great question, because as Jan know, that we sat 3 hours through a community board transportation committee hearing, and there were a lot of questions. And obviously, from the 70,000 miles up, whether you are in Canada or whether you are across the 48 states, or even in Europe, when you are so limited in space, lack of breathing room, and being constricted to a 6-foot radius, and then operate at maximum 50% capacity, it doesn't take a rocket scientist to figure out that you need more breathing room. And the question is, do you want to use the sidewalk, and do you want to use the street space? And so what has come out of that community board hearing is that the community board look at the list and just say, how come everything is on the Lower East Side? There's not a single street that's listed on the list. So that night, the Transportation Committee recommended a whole series of streets named to be placed so that DOT is aware that they may potentially be available if the merchants wants it. So as of this moment, as of last Saturday, only one street has been activated, and that's Doyers between Pell and Chatham Square. And that street, as you know, in the last 2 years, we have had very successful mural painting program, and that street is not heavily used. It's almost like appendage, very little car traffic. So the long and short of this is, think of this as an open safety street. And it is for the merchant to exercise. We're not imposing on anyone. We're asking if you want it. Do you need breathing room? Do you want to avoid altercations? Do you want to then apply for it? The space, the permit, the option is listed there on the community board for you. And if the merchant deem it necessary, then activate it. If not, leave it there. And so, and it's not our program, it's DOT program. And so it is up to a collaborative decision. But I would say this, that it is, just keep in mind, this will be one of the darkest winters. That's why you get a sense of a lot of people are very anxious, very uncomfortable. They know how much a massive jolt this is to the economic system. Obviously, after the physical health comes the economic health. And obviously, there's a lot of instability into that. For the eateries, that is highly, highly vulnerable, whether it's in Little Italy, whether it's in Chinatown or elsewhere. your summer months are your times. This option won't be available come fall or winter. And so do you want to exercise the month of July and August, maybe a little portion of September, to extend your selling space, extend your breathing space, extend your safety space? And it is your call. And so therefore it is up to the merchant to see I always think about how tight these tenement 18th century, 19th century buildings are. And as of this moment, we are not allowed to put any furniture or anything. So the street is just being used for you so that you could be placing your markers at 6 feet apart and things like that. And so this is, again, but if you saw, there's a video on our facebook.com/CPLDC or other videos as well, a video showing how other countries, Long Island just now, the whole town, this afternoon, the whole street is being petitioned. The whole main street is being turned into what is an open street. And the merchants are demanding it. So it is up to the local merchants that if you don't have enough space and if you want to get into the situation where you may be altercations, and people are not comfortable in going indoors. So this is an option. Long and short of it is for the merchant to decide.
Great. And I would just note that Bill Russo has made a few comments this evening about Little Italy. I am actually scheduled to meet with a bunch of representatives of Little Italy about some particular ideas for that community. And Mr. Russo, if you want to contact us, welcome to include you in those conversations. And obviously, the experience in Chinatown is, Chinatown is a distinctive place, but obviously these, this issue of trying to get street space, especially for restaurants and other businesses where people want to, linger, but may not be able to do so indoors is an important thing. So if people want to follow up with our office about particular suggestions about streets and how to make sure they're connecting with the Open Streets program, or seeking information about how to get permits for sidewalk space that you haven't previously used, that is something that you can contact our office directly with as well. We've a lot of questions about enforcement various times during the chat tonight, whether there should be formal orders mandating masks in public spaces, the extent to which the city will be, there's obviously been some controversy around some of the enforcement actions and some very troubling scenes involving NYPD. Can somebody talk to the question of the extent to which there'll be guidance? We've heard about, ambassadors, which might be a nicer term than enforcers, but we talk a little bit about that aspect of this, to what extent people will be out reminding people, maybe taking more aggressive steps to make sure people are doing what they're supposed to do.
Let me take a first shot at that, and then Jackie, I'll bet you have something more specific. Yeah. I want to remind people that there are certain things that that society was quite concerned about, where we've really had a major shift. For example, I'm old enough to remember that in the back of the movie section was where the smokers were, and people smoked all through the movie. Yeah, Mr. Book is laughing, right? Okay, now I think it would be absolutely unheard of for a bunch of people to start smoking in a movie theater. And we do not have police in every movie theater. In fact, we don't have police in movie theaters to enforce that. So we want to get to a place where there is a social enforcement. It becomes so much the norm. It's just what's done. And it's kind of, no, you're not going to do that. Just like you would not smoke a cigarette in a movie theater. So I think some people want to kind of rush to this very hard idea about enforcement. And I just want to, from a public health point of view, in the beginning of time, people said no one is going to use a seatbelt, and we're not going to be able to enforce it in people's cars because they're in their cars alone. And the fact is now that the vast, vast majority, not everybody, but the vast majority of people buckle up, even types, that people would say, oh no, that 20 years ago, 30 years ago. So there is a way that we all can be responsible for changing our collective behavior. And I want to put a little plug in for that, because we've actually been quite successful at doing that in terms of smoking. People don't smoke in bars anymore. That's not that long ago that was true. And we do not have a police person, an officer in every bar, you know, at all. So there are ways that we can enforce, but it's really all of us enforcing. So I know there are some other specifics, but that's an important thing to put out.
I'm going to just jump in because while you're speaking, you're not seeing, so you're getting a little skepticism here. It's just not social enforcement. Come to the Lower East Side any weekend. It's crowded and no masks. A salon was open today, no masks, right? And if, you know, to the extent they're not smoking in bars, they're smoking under our windows, which is a common concern in a place like Lower East Side.
Yeah.
Just like to the extent that people are not, you know, but I agree with you that we do need more, we do need more, you know, everybody to be responsible and encourage each other to be responsible. But to the extent, like, if you call 311 and say there's a salon open and they're not practicing social distancing, will the city respond?
Jackie, do you?
Yes, and you know, yes, we will respond, and we have been responding. I would say that from my perspective, and you know, I'm really focused on testing and tracing and helping people safely separate themselves. We know that New Yorkers want to keep each other safe, and in particular, we know that they want to keep their family safe. So we are going to rely on a really big education campaign. We launched a $10 million public education campaign a couple days ago. We're going to double down on that. We are hiring people from the most impacted communities to literally go door to door, to literally be out in communities, educating people. We're doing things like this teletown hall to make sure that New Yorkers know how to keep each other safe. I have to say I've been quite moved by this just to me unprecedented civic solidarity. New York City, we have all been staying inside. We've all been, you know, by and large, following the protocols we need to follow. Like the doctor said earlier, our fatality rate is down, our case rate is down. When I started this work in early March, and I said to an expert, hey, you know, like, if we shut it all down, how much are we going to reduce the number of people we all come in contact with? And they said, maybe 30%. Maybe the best we could do is 30%. Well, we went way beyond that. We reduced our mobility 60, 65%. New Yorkers have stepped up, and they've shown a tremendous amount of solidarity with one another. And I'm very proud of that. And I think we're going to see that in this next phase as we move from mitigating to suppressing the virus. And we're going to be asking New Yorkers to do hard things. It's not easy to go get a test over and over and over again. It's not easy if you are a contact of someone or if you have COVID to safely separate yourself and really not leave your home for 14 days. But I think that the overwhelming sense that I get from New Yorkers is they want to keep each other safe. They want to keep their family safe, and they're going to do what it takes to do that. But you know, it's going to take lots of public education that we're going to put lots of resources behind, and a lot of work to make sure that that's where we are and that's where we stay. But yes, you can, you know, if there is a salon that's open inappropriately, you can call 311. We will respond.
Okay, and so we are now at 7:59, 1 minute before the scheduled end of this town hall. I appreciate. Let me just take a moment to thank all the panels, and I just want to note on this particular topic, we've gotten a number of people have noted that yes, there's become social enforcement of seatbelt laws and smoking. I would also note the pooper scooper law. I'm old enough to remember when it was an odd idea that you would pick up after your dog. Now, if you don't do that, people think you're really, retrograde. But people have noted in the chat that each of those things also did come with you could get a ticket if you don't wear a seatbelt or you don't do those other things. So, and smoking in bars. So there may be a little bit of a carrot and a stick, at least from the perspective of many of our people who are commenting today.
And Senator, if I may, just
please, Wellington.
I just want to clarify that Open Street. I want to let Little Italy know, just like Wilson Tang from Namwa asked DOT to close Doyle Street, and so we immediately comply. That City Council today was also passing a bill, I think was asking that even if an area that may not be in front of you, may not be appropriate for using a thing, but you need additional breathing room space, and you find a surrounding plaza area, like in front of Manhattan Bridge, that you want to use that for space, by all means. So just think about alternate ways that you can create room so that to create safety. And so you need to go to there's a website that you can go and apply and let people know that you want it. and then the city can react, and then we will follow up.
Great. And recognizing that with all these issues, there's going to be complicated balancing to be done. Somebody noted that when you close streets, you also might reduce parking, and a lot of these businesses do rely on people driving, especially when people might be continue to have some concern about using mass transit. So there are going to be some balancing. Our office will work with you or your community also to try to get the right answers and to build consensus among business owners and the city about how to implement these things.
Delivery can still be done, and then emergency vehicles needs to get through. So, and if you want to drop off, it still can be done. So it's not like totally closed. It's just saying like that. So that's okay.
So it's going to, okay. And I just want to note, we got a lot of people continuing to talk about why aren't we talking about housing tonight? If you go to our website, we actually passed some bills. There's some video of me speaking about that about an hour and a half ago. I will actually be back on the Senate floor speaking about housing shortly. And that'll also be posted, and you can follow up with our office about specific question. Just more generally.
And there is, if people, sorry, Senator, you know, housing is a passion of mine too. We did set up a specific tenant hotline during the COVID crisis. So if you call 311 and you ask for the tenant hotline, that will go to experts that can help any tenants or any renters that are struggling right now.
Great. Okay. And thank you. So again, having so many people commenting and questioning is a good problem to have during town hall. With apologies to those we haven't gotten to your specific questions, we will post additional information. We'll also download the questions. And if there are specific things people are asked that we didn't get to, we will try to get to those things. For now, I just want to say, first of all, thank you to all of our panelists. Thank you to our translators. Thank you to my staff who have been very helpful in, of course, putting this together, but also are working tirelessly every day to get us all through this. So thank you. And as someone said just a minute ago, let's stick together and, you know, try to do this in the most, you know, constructive way possible, although maybe we'll need some, you know, fines at some point, at least according to some of our people. And just again, if you want to reach us, we are at 212-298-5565 or Kavanagh, KAVANAGH @nysenate.gov. Again, thank you for participating tonight. Thank you to all our panelists, and thank you to everybody at home who joined us. Have a good night.
Thank you, Senator. Good night, everyone.
Good night, Senator. Good night, everyone.
Thank you.
Thank you for this. Very good.
We really appreciate it.
Okay.
Good night.